Hey friends! So today I wanted to talk to you guys about the top 4 mistakes that new parents make in regards to electronic fetal monitoring. Electronic fetal monitoring is when you get to the hospital, you're hopefully in labor, and the nurses slap on these monitors. They're these round monitors, go on your belly. One monitors contractions and one monitors the baby's heart rate. This is kind of an example of what it would look like. I drew it. So the top one, this top line, would be the baby's heart rate, okay? So we like to see all that squiggliness. That's not a medical term, by the way, but we call it variability. We like to see that variability, and we like to see those little peaks, those accelerations. Now on the bottom, in the green, we have the contractions. Here, there are actually contractions, but sometimes it looks more flat, and that means either the monitor's in the wrong place or you're actually not having any contractions. So each column right here represents 1 minute. So you can see here that this contraction lasted about 1 minute. It's a little off to the side. And then about 3 minutes later, another contraction. And then 2 minutes later, another contraction. So we would call these contractions 2 to 3 minutes apart. So now that you kind of know what I'm talking about, these are the top 4 mistakes that new parents can make in regards to electronic fetal monitoring. Sometimes we just call it the tracing or fetal monitoring or heart tones. There's different kind of terms that we use. So number 1, being overly concerned about the tracing. So this would be like the patient who's calling the nurse every time the heart rate goes up or down or a little below see these red lines right here. I forgot to explain, kind of mark the borders of like how high the heart rate should go and how low, but that's for the baseline of the heart rate. So you can kind of see, like if I trace my finger here, there's the baseline of about 140 beats per minute. And then if it goes up, sometimes that's really good. If the baseline is above the red line or below the red line, that would be an indication to us as the nurses to do something. We have some interventions for that. Or if quickly it drops below and then comes back up, that would be another indication for us to employ some interventions. The nurses have monitors all throughout the nurses station so that we can watch all the patients on the unit and make sure that babies are doing well and the contractions are looking good, and we're always keeping track of that. Number 2 is thinking that the contractions are really big or too small. So the thing about the external TOCO, or the contraction monitor, is that it only picks up the tension on the mother's abdomen during a contraction. It's not actually measuring the strength of the contraction. So the external monitor doesn't give you a measurement of how strong the contractions are. They just show us the length of each contraction and the frequency, so the distance between contractions. But if your water is broken and the doctor feels that it's necessary, the doctor can insert an internal uterine pressure catheter, or an IUPC. And with the internal monitors, we can tell the actual strength of the contractions because the monitor goes in the vagina, into the uterus, kind of next to the baby's head, and it can pick up the strength and measured in millimeters of mercury. So only with the IUPC can we actually tell the strength of the contractions. Mistake number 3 is being afraid to move around. So I think a lot of people, when they have the monitors on them, they're thinking, I can't move because if I move, then the monitor will come undone or whatever. But actually, you need to be mobile in labor, and it's good to switch sides and sit on a ball and stand by your bed and get up to go to the bathroom. And you can even ask if your hospital offers telemetry monitoring or wireless monitoring so that you can freely walk about in your room or even go for a walk in the hallways. and we can still pick up on your tracing. Mistake number 4 is not knowing about or not asking for intermittent fetal monitoring. So intermittent fetal monitoring is exactly what it sounds like, just means on and off monitoring. So a lot of hospitals will do this differently, but the way that I'm familiar with is we do 20 minutes on the monitor and then 40 minutes off. But you can lose that privilege if we see anything concerning about the tracing. So the top 4 mistakes: being overly concerned, thinking the contractions are too big or too small, being afraid to move around, and not asking or not knowing about intermittent fetal monitoring.